The 5th Annual Digital Health Hub Foundation Awards seeks to find the most impactful and disruptive digital health companies. Out of 1,500 submissions, only a select few have become quarterfinalists. Let's learn what their superpower is.
FlowPatch is the world's first wireless wearable point-of-care Doppler ultrasound system. This novel device provides dynamic assessments that quickly and non-invasively determines a patient's response to IV fluids. Critically ill patients often present with signs and symptoms of low blood flow and are administered IV fluids to increase stroke volume. However, in as many as 50% of these patients, IV fluids may be contraindicated and can even result in adverse events such as pulmonary edema and kidney injury. Knowing when IV fluids are ineffective can reduce the risk of immediate or downstream fluid overload. FlowPatch adheres to the neck and assesses the carotid artery Doppler pulse. Since changes in carotid Doppler reflect changes in stroke volume, FlowPatch gives clinicians a window into the left ventricle and helps determine whether IV fluids will have the desired effect. FlowPatch's compact, user-friendly design helps clinicians make more objective decisions about fluid administration early and often throughout the continuum of care, especially in patients with sepsis and septic shock.
Now, hear in their own words why they should win.
I'm Dr. John Emil Kenny. I'm the co-founder and chief medical officer of Flosonics Medical, and I'm here representing the FlowPatch. And this was an idea that was born from a common problem that would be seen in the hospital all the time, and that was patients just getting intravenous fluids without objective measures guiding the provision of those fluids, and they would get overloaded. They would end up on the ventilator, they end up needing dialysis. And it's super common that patients are getting IV fluids and they're actually not responding the way that you think that they are. And that number is as high as 50%. And so one way to address that is through ultrasound. And I was a big point of care ultrasound user, and I'd use it in the hospital often to make management decisions for my patients, but it was really cumbersome. So the idea for Flosonics is that it's a wireless wearable Doppler ultrasound system. And its superpower is that it's a completely new way of looking at the heart, looking at a peripheral vein and artery, and using that as a completely new perspective on resuscitation and the direction the heart is moving is something that's never been done before. And it's really worthy of this award, in my biased opinion. The reason that I think we should win is all the problems that the team at Flosonics have solved: the engineering, software, hardware, the clinical translation of the product. Everyone who I work with who support this project, they're really the reason that I think that we should win.
Follow their journey as they strive to become a finalist against a very strong field. Join us on October 9th for our grand finale at Health in Las Vegas to witness the winners crowned.